Hi everyone, welcome back to our YouTube channel RPIIT Academy. I Shamli, working as an assistant professor in RPIIMS College of Nursing, Bistara, Kanna. Today in this video, I'll discuss about the glossary of neurosurgery. So it's firstly I start with the A letter. The first is abscess. So abscess mean it is a circumscribed collection of a pus. Next is a acoustic neuromas. Neuromas is a benign tumors of the hearing nerve that is our eighth cranial nerve. Next is acromegaly. Acromegaly, it is a disorder which was marked by the progressive enlargement of head. Here the megaly words denote the enlargements. So basically what happened here, it is there is an enlargement of the head, face, hands, feet and thorax due to the excessive secretion of the growth hormones. So what happened here, due to the release of excessive secretion of growth hormones, which leads to the enlargement of head, face, hands, feet and thorax. Next is adenoma. Adenoma is a benign growth which is formed of the granular tissues. Next is agnosia. Agnosia is the absence of the ability to recognize the form and the nature of persons and things. Next is agraphia. So agraphia which related to the when the person is right. So what is the agraphia means? The person is unable to write due to either muscular coordination issues or inability to phrase a thought. Next is amaurosis. So what amaurosis is? Loss of vision without a visible lesion in the eye structure or the optic nerve. Next is amaurosis frugs. It is a temporary blindness that occur for a short period of a time. Next is amenorrhea. So amenorrhea is the absence of the menses due to the cause or other than the pregnancy or age. Next is amnesia. It is a loss of defined as a loss of memory that was caused by any brain damage or by the severe emotional trauma. Brain damage due to head injury, any accidents or the tumor growth. Next is analgesia. Analgesia, it is a loss of sensitivity to the pain or a loss of response to the painful stimulus. So it is analgesia. Next is anaphylaxia. Anaphylaxia is a term that are used for the alteration in the cell characters which constitute to the malignancy, or in the case of body cell, it is the reversion of a more primitive condition. Next is anastomosis. So anastomosis, it is a communication, either it is a direct or indirect. In this we join the two parts together, joining together in the nervous system or joining of nerves or the blood vessel. That is the example of anastomosis. Next is anesthesiologist. So it is the physician who administered a pain-killing medications during the surgery or who administered the anesthesia during a surgery. Next is anencephaly. Anencephaly is defined as a absence of the greater part of the brain, often with the skull deformity. Next is anesthesia. Anesthesia is defined as a loss of sensation of the body part or a body that is induced by administration of drugs. When we administer the drug to the patients during their surgical procedures or minor procedures, that will lead to the loss of sensation of the body part. Next is anesthesiologist, which I already discussed, that it is a physician who administered the analgesia and monitor the complications and their reactions during surgery. Next is aneurysm. Aneurysm is dilatation of an arteries that is formed by a circumscribed enlargement of its bowels. So it is a different type of aneurysm: true aneurysm, false aneurysm, according to the structure it is also defined. Next is angiogram. So angiogram, it is a medical imaging reports that shows the blood vessels leading to and in the brain, which are obtained by injecting a dye or a contrast substance through a catheter. Angiography. Angiography is defined as a radiography of the blood vessels by using injections of the material or opaque or a dye to X-rays, which gives the better definitions or better structures of the vessels. Next is anorexia. So anorexia is an eating disorders which is marked by loss of appetite, which leads to the excessive weight loss. Next is anorexic. So it is defined as without the sense of smell, a person who having a problems who cannot smell sense of smell. So next is anoxia. Anoxia is defined as the absence of oxygen. Next is anticoagulants. It is the medications which prevents the coagulation of the blood. Next is antidiuretic. Antidiuretics are the agents which are used to reduce the urine output. Next is aphasia. Aphasia is defined as difficult to be the loss of use language in any cerebral base, including writing, reading, speaking, which is not related to the intelligence but due to the specific lesions present in the brain. Next is apnea. It is a temporary cessation of breathing, which is known as apnea. Next is apoplexy. Apoplexy is used as equivalent to the stroke. This is a condition in which there is a bleeding into an organ or a blood flow to an organ has ceased. Next is an arachnoid. So arachnoid is a middle layer of the membrane which covers the brain and our spinal cord. Next is arachnoiditis. Whenever there is a term is itis words comes, that means it is then the inflammation. So what here it is a arachnoiditis. So it is the inflammation of arachnoid membranes that is commonly seen or which we already discussed, that it is a middle layer of membranes that cover the brain and spinal cord. Next is the area cortical. So it is a part of the brain which having a special function, as in like the motor and sensory functions. The motor functions which control the movement of the persons, and the sensory which control the sensation of the person. So this is about the cortical. Next is the arteriography. So arteriography is same as an angiography, in which we inject a dye or a opaque and observe the structure of an arteries or vessels. Next is arteriosclerosis. It is the thickening and the calcification of the arterial wall with the loss of elasticity and the contractility. Next is arteriovenous. It is relating to both the that it's combined with the two words, that is artery and venous. So it is related with both the word, that is arteries and vein. Next is arteriovenous malformation. So there is a malformation when there is some abnormal collection between the arteries and veins. So it is defined as a collection of blood vessels with one or several abnormal collection between the arteries and vein that may cause hemorrhage or seizure. So I hope this video helped you. Thank you for watching it.